Assalamu alaikum, good morning. Today I will speak to you about a very important neurotransmitter that people need in their brain, and also they need it in their gut. So it's made in the brain and it's also made in the gut. And remember that the gut and the brain communicate to each other through certain messengers in the bloodstream called cytokines. So in other words, if you have a problem in the brain, it affects the gut. If you have a problem in the gut, it affects the brain. So we're going to speak about serotonin. So serotonin is a neurotransmitter. That means that it needs to travel from one nerve to the other nerve to the next nerve. So sometimes when people talk about this person has a chemical imbalance in their brain, this is one of the neurotransmitters that quite frequently is referred to, because when you don't have enough of it, it can create a whole host of problems with mental health, but many other problems as well. So if you look at this really nice diagram, you can see, so I'm going to show you where serotonin is made in the central nervous system. So here, this is your brainstem right here. So the top of your brainstem is called your midbrain. It's also called your mesencephalon. And then we have the pons, which is this outpouching right here. And then we have the medulla oblongata, which is down here. So these little orange areas are different nuclei or groups of cell tissues that create this serotonin. So if you were to injure this area, you wouldn't be able to make it. Or if you were to injure the areas that the serotonin projects to, then you wouldn't have enough of it. So you can see where it goes. It goes into the cerebellum, which is this walnut back here. The cerebellum is just an incredible area of the brain, because it's kind of the last frontier of what we are understanding about the brain, but it's just very complicated because it affects organs, it affects balance, it can give you dizziness if it doesn't work. It's just an incredible important area, and it's very dependent on oxygen and regulated glucose. But basically, you can see, though, that this will travel, so these serotonergic projections, they travel up into, the frontal lobe, and then up through the parietal lobe, and the temporal lobe, and then down into the occipital lobe. So any part of brain function, all parts of the brain really do depend on serotonin and the balance of serotonin. And of course, like I said, the brain depends on the gut, and the gut depends on the brain. So let's get into it a little bit more. So some of the symptoms, how would you know if you don't have enough serotonin? You can't really do a blood test that's just for serotonin. And there's people that tell you can do a saliva test. It's not valid. So here's some of the symptoms. If you have osteoporosis, you probably don't have enough serotonin. If you have poor wound healing, probably not enough serotonin. Post-traumatic stress disorder is a problem that doesn't have enough serotonin. If you have chronic pain, meaning that you've had pain for more than a year and it's not going away, you don't have enough serotonin. If you have unusual sexual behavior, so some people have some really interesting ways that they manifest sexual behavior, usually that's related to not enough serotonin. Also, if you don't sleep very well, if you get poor sleep, that can be from not enough serotonin. And there's a specific part of sleep that is difficult when you don't have enough serotonin, and that's when it's difficult to fall asleep. Because in order to make melatonin, you need serotonin. Also, this is linked to depression. It's not the only neurotransmitter linked to depression, but it is. And many people that are taking antidepressants are really taking SSRIs, which are trying to recycle the serotonin that you don't make. So we'll talk about how to actually make it so you don't have to recycle what you don't make. It makes way more sense to go after why you don't make it, rather than just take something to try to recycle what you don't make, but it also gives you all kinds of side effects. If you have anxiety or panic disorders, it's also oftentimes linked to serotonin. If you have any kind of digestive problems, like chronic constipation, for example, it can be related to serotonin. If you have poor cognitive function, so you don't remember things, or you have a hard time learning, it can be related to serotonin. If you have obsessive compulsive disorder, it can be also related to serotonin. Schizophrenia and bipolar are definitely related to serotonin. If you have aggression, so if you get angry really easily and you are physically or verbally aggressive, very likely not enough serotonin. Eating disorders, so bulimia, etc. These things are related to not enough serotonin. Suicidal behavior, not enough serotonin. Low immune system or ulcers are also linked to serotonin. So let's ask ourselves then, if this is the symptoms, what makes serotonin levels drop? One of them is dysglycemia. This is probably the #1 reason, actually. So how do you know if you have dysglycemia? If your blood sugar runs high, so if you're a diabetic, absolutely. But if you are pre-diabetic, or if if your blood sugar runs low, or if you have an abdomen that's not flat and you're not a pregnant woman, these are going to be signs of dysglycemia. So you want to address your diet. You want to quit eating foods that are going to spike your blood sugar, quit drinking alcohol, and quit eating sugar. Also, if you have any kind of anemia, whether it's a macrocytic anemia or a microcytic anemia or a normocytic anemia, you need to address it because it will prevent your body from making the serotonin that you need. If you have any brain injury, just like I showed you on this diagram here, if you have any kind of brain injury, it will affect serotonin. So there's things you can do that can help you make serotonin even when you have a brain injury. If you have brain inflammation or brain atrophy, then you also will have a problem with making serotonin. Smoking prevents you from making serotonin. So it's a good idea not to smoke. And there is a connection between smoking and mental health problems. Inactivity. So people should be busy. They should be moving. They should be out doing things. They just shouldn't be sitting around in their wheelchair. If you're in a wheelchair, start doing some kind of movements. And sometimes you have to help people move, help them move around because it will help them with serotonin. So exercise is actually a really good thing for serotonin. Just staying indoors all the time is also hard for your body to make serotonin. Caffeine, which I enjoy so much, helps you not make serotonin. So, make sure you're not having so much caffeine that it affects your ability to make serotonin. If you're on antidepressants, this is kind of horrible because, people are taking antidepressants for their depression, but this antidepressant will prevent you from making serotonin. So, when you're taking an SSRI to try to recycle what you don't make, it also keeps you from making it as well. Statin drugs. Understand that when you go on a statin drug, it can give you all the symptoms I just told you because it can keep you from making serotonin. So statin drugs really are not the best thing in the world, especially because they target cholesterol, which is what your brain is made out of. You don't want to go after the cholesterol that's good. And it's true that some people have high cholesterol, and there's other ways of managing it that I think are better than statin drugs. So there are supplements that you can take that help with serotonin. One of them is niacinamide. You can take B6, B12, folic acid, magnesium. There's different herbs that you can take. You can take St. John's wort, 5-hydroxytryptophan, SAM-E. These are all things that you can take. I think the best supplement is called serotonin because serotonin has all the cofactors and precursors that you need to actually start making serotonin right now. So, if you're not making it because you have some of these issues that keep you from making it, then the supplement is a very good thing because it will help you start making it right now. You can use that supplement as a crutch until you can throw your crutch away and you don't need to have that anymore and your body's doing it all by itself. So some of the things that you can also do that help you to make serotonin, or I should say to activate the serotonergic pathways, are neurofeedback, where we can actually drive the different frequencies of the brain and make them more efficient. Eye exercises, so we can, through the eyes, we can activate the cerebellum. From the cerebellum, we can start waking up this area right here, which activates everything else. So, you know, it's a pretty amazing thing. And at some point I'm going to speak about why brain exercises are so important and why people should actually do them. And you also want to make sure that you target why you don't make serotonin. So if you have any kind of dysglycemia, like I spoke about earlier, or any kind of anemia, or if you don't have enough magnesium, then you want to address those. And you know, the best source of magnesium, in my opinion, is dark leafy greens. And that's something that people should be eating much more of. Don't be shy. Have a big salad or have broccoli, you know, kale, things like that. They're just really useful to get your magnesium. So we're going to talk about the drugs that people generally take to manage their serotonin imbalances. Remember I said that these antidepressants prevent you from making serotonin. So it's kind of a catch-22 with these. So even though they might make you feel better, you know, but they also prevent you from actually fixing why you have your problem. So, you know, because they can lead to more insulin resistance by actually making you gain weight. And you know, listen, if you're suicidal, you should absolutely be on a drug because you might hurt yourself or hurt people around you. But if you're not suicidal, then go after the cause instead of just treating the symptom. But some examples of SSRIs are going to be citalopram, also called Celexa, Lexapro, fluoxetine, Prozac, Paxil, Zoloft, sertraline. Some of these are interchangeable because there's more than one name for these. But some of the side effects include nausea, vomiting, diarrhea, headaches, sexual dysfunction, weight gain, nervousness, dizziness, erectile dysfunction, insomnia, and agitation, as well as drowsiness and dry mouth. So, you know, you have to ask yourself a question, and this is, I think, a very important question when we look at our total health, because my goal for my patients, it's not just to help you for a little while, it's to help you for the rest of your life. But, you know, when you study drugs, you know, in medical school, we call it toxicology. Toxicology means the study of poison. Can you really poison a person into being healthier? And I would say that the answer would be no. And that's why when you take medications, there really are side effects. Sometimes, you know, it's the best option that people have under certain circumstances, but really lifestyle is the way to go. So you want to find a way to create a sustainable lifestyle that's going to make you live longer and have a better quality of life, rather than just having, you know, medications thrown at you to pacify your symptoms. It makes way more sense to treat the why rather than just the what. So that's my final thought for this lecture, and I will catch you next time.